All you need, all you need is a few things occurring. So say you're a woman and you have some lymphedema, and you have a little bit of edema. That means fluid retention. So you're dealing with some fluid. And I'm not just talking about weight or extra weight gain. I'm talking about fluid retention, just a little bit of that happening periodically, and you have endometriosis. The fluid retention puts pressure. This isn't even a cycle or a period, a menstrual cycle I'm talking about now. Fluid retention, it puts pressure on everything in there. There's no place to go with that fluid retention, especially lymphatic system. There's no place to go. So that pressure alone can be uncomfortable when you're dealing with endometriosis periodically. Make it really uncomfortable. The experiences could be really uncomfortable. If your bladder gets too full, so if you're holding in a pee, if you're holding in a pee, and your kidneys got as much pee as they can hold in, and your bladder, so you're holding that in with everything you have, and you got endometriosis, and the extra urine in the bladder pushes, kind of blows the bladder up a little bit like a balloon, and it's got a little bit of those pods, or it has a little bit of the intramural cells sitting on outside the bladder, and they're all touching nerves. So the minute you have a little bit more urine in your bladder, oh my God, it's going to hurt. It could burn, it could hurt, it could be painful. You can get spastic bladder, something actually medical communities are really not too familiar with, the spastic bladder. So, and you can get these bladder spasms, lots of these nerve-related bladder spasms. So it's nerves triggering off the bladder because the nerves are sensitive, because they got the intramural cells and the little pods, little microadhesions, macroadhesions attached to the outside of the bladder. So then all of a sudden you're getting these spasms. And that occurs. And every woman is different, because they'll, you could have a little bit on the bladder, you could have a little bit on the colon, you could have a little bit around the ovaries, you can have just one spot, a little bit around the colon, and nowhere else. And you're getting some colon spasms. So when you have your menstrual cycle and there's all this pressure building up from the menstrual cycle, it could put pressure up against the colon more because everything's so packed tightly. And then all of a sudden, it's pushing those little tiny cells into nerves. And when those get pushed into nerves, you're like, oh my God. You're like, this is such an uncomfortable menstrual cycle. This is brutal. Whether you're bleeding heavy or not. Some women, they're not bleeding heavy and they're just in agony and pain. Some women are bleeding heavy and they're in agony and pain too. So it's either or. And then when those little nerves are being touched by the pressure of a menstrual cycle pushing up against the colon and pushing against those pods and microadhesions and pushing them into the colon, then you got spastic colon occurring. I mean, I've seen some women, that have called, and they're just like, over the years, and they're like, oh my God, I'm on the floor. Or their husband would call me and just be like, look, they're on the floor. They're having, this is what she goes through all the time. We have to do something about it. And that's what women go through when they're dealing with endometriosis. And so we're going to talk about what to do actually to help stop endometriosis, to stop it from growing, because that's what you want it to do. You want it to stop it from growing. You want to shut it down. And there are some great things you can do to shut it down. So we're going to cover that. And so when people go into a spastic colon, you got to put heat on their belly, hot water bottle up against their belly, a moist, hot towel, anything like that. That does help to get women through spasms when they're going through that. But it's no fun. It's brutal. You guys know how brutal it is. And the same thing with spastic urinary issues with the bladder too. And that's also a real, that's a real hot spot, real trigger spot right there. And then ovary pain, that's a whole nother story. So when you have the microadhesions, the macroadhesions, and you have the little pods, and you have the little cysts, and you have the little growths from endometrial cells, you have that going on around the ovaries. And that's also really difficult too, because you can get some serious ovarian pain, especially during ovulation and so forth. So, and everything's so packed tight, things are hitting nerves. Why do you think the pain and the spasms come? Because nerves actually are the reason for pain and spasms, because the nerves are being touched or pushed upon or jabbed in one way or another in order for that to happen. And that's how we get into that place. So endometriosis is such a mystery to the medical world. Absolute mystery. I mean, they use the pill to try to address it, to get people, get women some results and relief. But how does the pill do that? Is it really blocking hormones or altering hormones? Is it doing that in order to give somebody relief? What it is doing is it's a steroid. So all contraceptives that are like that, like the pill, hormonal based contraceptives, they're actually steroids. And what happens is, with any condition of the body, doesn't matter what it is, whatever disease, illness, symptom, condition, mystery symptom, whatever it is, steroids are one of these go-to moments, one of these go-to situations for medical research and science. They have really not too many options. They got immunosuppressives for people, they got painkillers, they got steroids, they got antibiotics. That's pretty much what's going on in the medical industry. There's not much outside of that besides a few blood thinners. And if you want to go into antidepressant land and antipsychotic drugs, that's another story. But the point is, there's a lot of medications, but not a lot of options and small groups of medication. What I'm saying is, you think there's a lot more options. You got steroids, you got antibiotics, you got immunosuppressives. I mean, it's a small group, and you got painkillers. So research and science really doesn't have a magic pill. And a lot of women, they don't respond to a steroid. They don't respond to the pill. They don't respond to the pill for endometriosis. Some do, where it eases things, and many don't. So it's hit or miss too. When they do respond, it's because the steroid aspect of the pill is suppressing the inflammation part of the issue. So you get inflammation. So what happens is, endometrial cells, when they're clinging, when they're on the outside of the uterus and they're in the pelvic cavity and they're in areas and they're on the outside of the colon, or they're up against the bladder, they create they're kind of creating inflammation. But they're not really creating inflammation themselves, these little endometrial cells. Something else is, and we're about to talk about that in a little bit. So inflammation is created around this situation. I'm going to talk about that and clear that up a little bit so you know what's going on there. And so what's happening is, when you take the pill, which is a variety of steroid, it's a type of steroid, what happens is that you get some suppression of it. And that's what goes on. Women with severe endometriosis, they actually sometimes put them on not just the pill, but they put them on additional steroids periodically to try to get everything to calm down. So, but there's not a lot of options. So there's not a lot of things going on there in the medical world, and it's still a complete mystery to research and science. But there's ways to actually stop it. There's ways to diminish it. There's ways to push it back. And we can do that naturally through foods. We can do that naturally through certain supplements. So we're going to go into those. So we've covered a lot with what's happening here. And then the symptoms are really, you get the painful periods. You get also, when you're going to the bathroom, the bowel movements can be really, really difficult. So when elimination is occurring, that's difficult, because when you have peristaltic action on the colon and the colon's twisting, it's squeezing, and the peristaltic action's happening, and it's got the little pods and the little microadhesions on the outside of the colon tickling the nerves, and it's twisting or squeezing, peristaltic action occurring, where the colon's actually getting messages from nerves to actually move so that your elimination can come out of you, okay, and end up in the toilet. When that's happening, you could be really in a lot of pain from that. And that's one of the things so many women go through. And it gets confused. It gets confusing. And there's a lot of times you can go to 10 doctors, and one doctor will be like, I don't know what this is. I think you just got IBS. Another doctor will be like, I don't know what's going on. And then you get some women that have a little bit of IBS and they have endometriosis. Or they have endometriosis, but it's not causing the problem. And what they really have Is something happening in the intestinal tract? It's really difficult out there. It's so not clear cut, and it's not easy, and it should be. That's the hard part about chronic illness and everything that I deal with. You wonder why I get snarky, and you wonder why I get sarcastic, and you wonder why I talk about how the information here is different than the recycled theory that's out there. There's a reason why I talk about all that, because it should be easier. We shouldn't have to go through this. I've seen a lot of women and young women have to go to doctor and doctor to doctor. I've heard their stories out there. And they've had the different answers everywhere. One doctor's like, oh, no, it's really this. One doctor's like, oh, it's that. We think you have endometriosis. We're going to have to do this and this to do this. And meanwhile, no, that's not even what's causing the pain or the problem or the discomfort. And no, and you got this. And then it's endless. And maybe it's just candida and you got chronic yeast infections. We can't tell yet. We're going to figure this out. And it's just lots of tests, a lot of different confusion. And then you get blood work and you're going to another specialist, and yet then you leave with some kind of prescription, or you leave with a pill if you're not already on it. And then regardless of all that, you're still not doing good a year later. Then you end up getting fatigue. Nobody talks about that. You get the fatigue, and now you're tired, and now you don't feel good, and you're getting migraines, and it's all that going on, with young women having to deal with that, and older women having to deal with that. It's really, really difficult, and it shouldn't have to be that way in this day and age. We shouldn't have to be there. We just shouldn't have to be there when you really think about it. So there's a lot of theories out there. Let's talk about the theories for a couple of minutes. So science and research, they don't know how they don't know how endometriosis occurs. They don't know what happens. They got some guesses. So they've done a lot of round table guesses and had a lot of people talking and to figure out what, a lot of the top doctors in the world and big pharma and everything, they've gotten together, and they've come along with, science and research come along with a few theories. So one is called something like let's see, there's different, the peritoneal theory. So what this means is the inner abdomen, the inner side of the abdomen. Cells line the inner side of the abdomen because the immune system creates this problem. Or it's hormones or the immune system create the problem. So you got endometrial cells that are lining the inside of the abdomen. So it's like the peritoneal theory. So that's one. It really doesn't make a lot of sense. So then there's the retrograde theory. So it's called retrograde. That's another theory out there. And then, and look, I'm not an expert on the theories that are out there. I'm not an expert on the bogus theories. So don't quote me on the exact bogus theory thing. I'm an expert at the truth and the information that you need and the truth of what causes whatever disease, illness, and everything. That's where I'm an expert at, of course. And I say that because luckily I got spirit, and that's why I'm an expert. I wouldn't be without spirit. So it's not me being smart. I'm not a smart guy, okay? I never went to school. It's because of spirit. So the bottom line is these theories that are out there, they're tough to swallow. So the retrograde theory, that's when you're having a menstrual cycle. So menstruation is occurring and blood flows back up through the fallopian tubes into the pelvic cavity, spreading cells. I like that theory. I like it a little bit because, it's reasonable. It's a reasonable theory. So that's one there. It is reasonable. Anyway, another theory science and research has, it's embryonic cell transformation. I think that's what they call it, if my memory serves me right. I mean, you can look up these theories out there and look this up. You could probably read as much information as you want on it. And this has to do with intrametrial cell implants. So it's all about estrogen and intrametrial cell implants. So that you can read into that one. So that, these are still all theories. Another theory is C-section or a surgery. So when a woman gets a C-section or gets a surgery, that endometrial cells, they tend to find their way into the incisions, into the scar, into the incisions, or where the surgery or the injury was. And the endometrial cells tend to get in there and they spread and grow. It's a believable theory. It's kind of believable. That's one, too. And then there's another theory. It's cell transport. I like this one probably the best out of all the theories out there in the medical communities or the medical science and research world. Endometrial cell transport. This is when your lymphatic system transports cells to other areas of the body, so endometrial cells to the other area of the body.